Yang terhormat, Kepala Kantor Pengelolaan Perpustakaan Universitas Padjadjaran, the Honorable our speaker, training specialist from EBSCO, Mr. Ryan Salas. Yang kami hormati, moderator pada siang hari ini, Bapak Yanto M.I.Kom, serta hadirin yang berbahagia. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon everyone. Shalom, Om Swastiastu, Namo Buddhaya, salam kebajikan, salam sejahtera untuk kita semua. Puji dan syukur, marilah kita panjatkan kehadirat Tuhan Yang Maha Esa, karena berkat rahmat dan karunia-Nya kita semua hadir dalam acara webinar pada hari ini. Kepada seluruh peserta yang hadir, selamat datang dalam acara Mastering EBSCO Specialized Health and Medical Database, Jumat 8 Mei 2026 melalui platform Zoom Meeting. Sebelum kita memasuki acara inti, kita akan mendengarkan sambutan terlebih dahulu. Sambutan akan disampaikan oleh Kepala Kantor Pengelolaan Perpustakaan Universitas Padjadjaran. Kepada Ibu Dr. Ute Lisiti Hadijah, disilakan.
Terima kasih Ibu Nafa. Good afternoon everyone. Welcome to today meetings Mastering EBSCO Specialized Health and Medical Database. On behalf of the Library Management Office of Universitas Padjadjaran, I would like to thank you all participants for joining this session. We are also honored to welcome Mr. Ryan Salas. Hello Mr. Ryan Salas, nice to meet you. And then Mr. Yanto as the moderator. Today's our meeting is the great opportunity for our students to improve their skill in searching and assessing trust, health, and medical information resources. We hope this session will support your academic learning and research activities. Thank you once again for your participation. I hope everyone enjoy and benefit from this webinar. Have a wonderful session. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Terima kasih Bu Nafa, saya kembalikan.
Terima kasih banyak Ibu. Baik, tanpa berlama-lama lagi, kita langsung akan memasuki pada acara pemaparan materi. Pemaparan materi pada siang hari ini akan dipandu oleh seorang moderator. Beliau merupakan dosen dari Fakultas Ilmu Komunikasi Universitas Padjadjaran. Kepada Bapak Yanto M.I.Kom, disilakan. Bapak suaranya belum terdengar.
Halo,
Ya ada.
halo.
Ya ada.
Ya,
Ya.
sudah Pak.
Okay. Good afternoon, everyone. Welcome to today's webinar. My name is Andri. I will be your moderator for this session. This webinar is organized by Kantor Pengelolaan Perpustakaan Universitas Padjadjaran in collaboration with EBSCO. Before we begin, let me briefly go over a few rules. Number one, please keep your microphone mute during the presentation. And don't forget, use the virtual backgrounds. And the second one, you can write your question in the chat column. And this session will be recorded, and the recording will be shared with all participants later. Without further ado, let's start our session. It's now my great pleasure to introduce our speaker for today. We have Mr. Ryan Salas, training specialist from EBSCO. He has extensive experience in helping researchers and students to maximize the use of EBSCO's health and medical databases. Mr. Ryan, the floor is yours. We look forward to your insightful presentation. Please, Mr. Ryan.
Thank you, Mr. Adrianto. Just checking if I'm loud and clear. Is my
Yes,
audio clear? Great,
yes,
thank
it's
you.
clear.
Thank you. I'm going to share my screen and I would appreciate it if you can confirm if you can see my slides.
Yes, I can see your slide.
Okay, wonderful. Thank you. So, welcome to today's session on mastering EBSCO's specialized health and medical database. So, my name is Ryan Salas, and I am a training specialist for Southeast Asia at EBSCO Information Services. So, before we proceed with the session, I would also like to take this opportunity to invite everyone to join our ongoing competition. So it started last Thursday, actually yesterday, and the title of this competition is From Novice to Pro: Unlocking Research with EBSCO AI and EBSCO eBooks. And as the title suggests, this competition will focus on EBSCO AI tools and navigating EBSCO eBooks. So if you want to register, you can scan the QR code that's up on the screen. When you scan the QR code, you will see 4 sessions. So you can register for the second, third, and fourth session. And please make sure that you also sign up for our free training newsletter because that's one of the requirements. Then you need to attend or watch at least one of the sessions, and you need to complete the quiz within 1 week after the session. So the quiz is due by Thursday at midnight, your local time. And since this is a competition, of course, we're going to provide prizes. So the prize for the grand prize winner is 150 US dollars or equivalent to your local currency. There will also be one runner-up winner who will receive 50 US dollars or again equivalent in your local currency, and the participants will also receive a certificate for each session they attend. So if you have any questions regarding the competition, please let me know, or if you need any clarification. And I hope to see everyone next week, Thursday. Now, a little bit about myself and what I do at EBSCO. So my name is Ryan, as mentioned, and I train EBSCO customers across Singapore, Malaysia, the Philippines, and Indonesia. Prior to joining EBSCO in 2022, I was an academic librarian in the Philippines, and I'm also based in the Philippines, and I have a bachelor's degree in library and information science, and I've been with EBSCO for almost 4 years. And these are the objectives for this session. It is my hope that by the end of this webinar, you'll be able to navigate and use Dentistry and Oral Sciences Source, Medline Ultimate, and Sinal Complete. And we're also going to conduct a search using medical subject headings. Sorry, let me share my slides again. Sorry, just turn off my video. Thank my internet is a bit slow today. My apologies. All right, so going back to my objectives. So as mentioned, we're going to conduct a search using medical subject headings, or what we call MESH, describe and access special limiters on dentistry and oral sciences source. We're also going to cover Medline Ultimate and Sinal Complete. We're also going to apply facets and limiters to refine search results. I'm going to show you how you can use the available built-in tools and features for efficient research. And we're going to explore and apply EBSCO AI tools, access your personalized dashboard, and finally, we're going to locate relevant help and support materials. Now, before I continue, I would like to inform everyone that you can use the chat box feature, if you have any questions or concerns during my presentation, or you can also mute your microphone. Please don't feel like you have to wait until I'm done presenting. You can interrupt me during my presentation. So in this session, I'm also going to share some tips and tricks to help you elevate your searching experience. So I'm going to discuss Boolean operators, and Boolean logic defines relationships between search terms. It's comprised of simple words like and, or, and not. So these are conjunctions that we use to create a very narrow, broad, or you can also use it to omit a term. So first, we have the end Boolean operator. I'm also using Venn diagrams here because I'm a visual learner, so it's easier for me to understand and digest information if I'm seeing pictures or images. So we have the end Boolean operator, and you can refer to the Venn diagram. So as you can see, the middle part of the Venn diagram is shaded. So if you're going to use the end Boolean operator, it will combine and narrow your search. So the system will look for all records that include both diabetes and obesity. And as you can see, as highlighted here, if you're going to use the end Boolean operator, it will narrow down your search results. So if you want to retrieve manageable search results, you can combine your keywords using the end Boolean operator. Aside from the end Boolean operator, you can also combine your keywords using the or Boolean operator. So as you can see, both circles are shaded now. So you can think of it like your keywords. So if you're going to search using the or Boolean operator, the system will search for at least one of the keywords, or it could also include both search terms. Now, the consequence is it will broaden your search results. So that's your or Boolean operator. So it's very different from your end Boolean operator. And finally, we have the not Boolean operator. And this is used to omit a term from your search and also helps remove ambiguity. So you can use the not Boolean operator if you want to have a focus search. For example, you only want to search for records containing diabetes. So you can use the not Boolean operator, and the system will retrieve records containing diabetes only, and it will exclude records containing obesity. So that's your Boolean operators. So I'm going to pause for a while to check if there's any questions for me. So do you have any questions regarding the Boolean operators? If you don't have any questions, could you please give me a thumbs up reaction so I can continue and proceed with the next topic? I can see 3 reactions. Okay, thank you so much. So I'm seeing 6 reactions. So without further ado, let's now head over to the live demonstration. So if you want to access your platform, you can reach out to your library. Before I start, if you have any questions, you can use the chat box, or if you want me to slow down, sometimes I speak fast. So if you want me to slow down, just let me know. Or if you want me to discuss a specific feature, you can enter your question or your concern in the chat box. Now, the first database that we're going to explore is Medline Ultimate. So we're going to cover 3 databases in this session. So what is Medline Ultimate? So it's one of your subscriptions, and it is the most comprehensive companion to the Medline Index. It offers the largest collection. So this is the highest tier, and it contains top-tier biomedical journals, many of which are available with no embargo. So this means you gain access to high-quality peer-reviewed biomedical research as soon as it is published, helping you stay current with the latest developments in medicine, health sciences, and clinical research. As we all know, in the medical field, it's very crucial to receive or access the most recent information. So Medline Complete gives you that uh, access to journals with no embargo. Now, in addition to its extensive journal coverage, Medline Ultimate gives you access to a broad range of medical and health-related research subjects. And this includes content in behavioral sciences, supporting research into human behavior and mental health. It also covers biomedicine, along with life sciences and preclinical science. You'll also find materials related to health policy developments, helping users stay informed about trends, regulations, and decision making in healthcare systems. And this is just a snapshot. So, Medline Ultimate spans many additional subject areas, making it a comprehensive resource for medical education, research, and even clinical practice. Now, using this database, I'm going to show you how to run a search using medical subject headings, or what we call MESH. So, a little bit about MESH. It is the National Library of Medicine's Controlled Vocabulary Thesaurus, and each bibliographic reference is associated with a set of MESH or medical subject heading terms assigned to describe the content of an article. And mesh terms are arranged in hierarchy or tree structure that permits searching at various levels of details from the most general to the narrowest levels. And this helps you find the most precise terms. And subject specialists at the National Library of Medicine update mesh annually. So just in case you're wondering, they update it annually. And to guide us through this session, I have prepared here my search example. So using Medline medical subject heading, we're going to search for resources or records on nosebleed. So this will be our keyword. And you can also use limiters to narrow down results to what you need. So here is the platform. Before we run a search, I would like to walk you through the landing page. So upon logging in, you will see your search box, and your default search box is advanced search. So I'm going to talk about the advanced search feature later. On your left-hand side, you'll find your dashboard. So essentially, your dashboard will allow you to create your projects, your saved items. You can also track your recent searches or your recent activities. And then you also have your holds and checkouts. So this will be for your ebooks. So if you check out an ebook, you will see the titles that you've checked out in your holds and checkouts. And finally, your alerts will allow you to manage the alerts that you have set up. I'll circle back to this later to add more context. And you also have your research tools. You have your new search. So this acts like your home button. When you click on your new search button, it brings you back to the landing page. And it also clears out all the filters that you've applied in your previous search. And if it's your first time using the platform, so for first time users, you can go to help, you can click on this button, and it brings you to our Connect website. So this is our help website where you can access relevant information about EBSCO hosts or how to navigate the platform. So if you scroll down, you have your how-to information. So if you would like to know how to run a basic search, advanced search, or how to use facets, so you can visit this page. And then if you scroll further, you also have your database help. So this is very useful. When you click on this, I'm going to discuss field codes later, but I wanted to show you this file code database, or what we call the So this is what we call field codes. So if you want to access other field codes, so you can go to this page, just select the relevant database. So we're searching Medline. So you can access Medline Ultimate. And this allows you to access different field codes. So when you open this file, so it's going to show you all the field codes that you can use on the database. So let's go back. So that's your help. And you also have your publications authority. I'm going to talk about this later. You have CINAHL headings, and here is Medline medical subject heading. So before we run a search, I would also like to encourage you to log into your My EBSCO account. So when you go to your dashboard, I just wanted to show you the importance of logging into your My EBSCO account. Now, when you go and access your EBSCO host platform from the landing page, when you access your dashboard, you won't see anything here. So even if I go to my Save tab, I'm not seeing any items here. The reason is I haven't signed in to my EBSCO account. So your My EBSCO account is your personal account, and it allows you to access the items that you've saved, all the projects that you've created, and it also allows you to create alerts. So if you want to access all the projects that you've created and all the items that you've saved, you can sign in to your My EBSCO account. You can click on sign in from the projects. You can also click on the My EBSCO button, and you have here create an account. So if you haven't created an account, you can click on create an account, and then you can create an account for free. So I'm going to click on this. So if you want to create your personal account, you need to fill out this form. So you need to enter your first name, your last name, your email address, and your password. And once you're done, just tick the consent box and click on create account. So these are the account benefits. Aside from the ability to save your search permanently, you can also sync with the mobile app. In case you don't know, we have a free mobile app that you can download. It's available for both Apple and Android devices. And if you're going to use the same My EBSCO account, you'll be able to sync the items on your desktop with the mobile app. So you can take your research on the go. And you can also create projects as mentioned earlier, and you can also download ebooks that are DRM protected. So of course, you can also save your search and never have to worry about losing any items. So click on sign in. I hope that's clear, and I hope that you will create your personal account. So click on sign in now, and I'll log into my EBSCO account. Now, once you have logged in, so when we go back to our projects, so I'm now seeing my 35 projects. Earlier, I couldn't see my saved items and my projects because I haven't logged in to my EBSCO account. So let's click on new search. And as mentioned, it's going to just take you back to the landing page. So if you want to access CINAHL headings or Medline, so for this search example, I'm going to use Medline, but you also have CINAHL headings. Now, the difference between Medline and CINAHL headings include additional nursing subject headings. So that's the difference. But essentially, it's still using medical subject headings, but with additional subject headings related to nursing. So we're going to use Medline. So let's click on this, and you'll see a search box here. So you have your Medline mesh for 2026. What you can do is you can enter any keywords here. So since I'm not a medical practitioner, I am going to search for records on nosebleed, and I'm going to search for nosebleed because I'm not aware of the medical term. One of the benefits of using medical subject heading is it's going to show you the medical term of a certain term. So if I search for nosebleed, and if I run a search, so as you can see, it's telling me that nosebleed is the common term, but it's also going to refer me to the medical term. So as medical practitioners, you probably won't call this nosebleed. So the medical term for nosebleed is epistaxis. Now, when you click on this, as mentioned earlier, Medline has a hierarchy or what we call the tree structure. Now, when you click on epistaxis, so it's going to bring you to the tree view. So it's telling us that epistaxis is under the broader term respiratory tract diseases. And under respiratory tract diseases, you have nose diseases, you have nose neoplasm, rhinitis, paranasal sinus diseases, and so on. So it's just telling us that epistaxis is under the broader term nose diseases. So what you can do is you can tick this box. You can also add this. So you can combine epistaxis with one or more subject headings to restrict your search. So you can combine epistaxis with, let's say, rehabilitation. You also have genetics. So I can also add that to my search. And once I'm happy with the terms that I've selected, I can now click on add to search. And then the system will add my terms in my search box. So I have MH here, and it's just telling me that these terms are coming from medical subject heading. Now, when I click on search, it's going to bring me to the search results. So I've got 64 results. Now, if you want to export the metadata, there is an option here called bulk export. And this is useful for those who are conducting systematic reviews. So if you want to save time, you can bulk export the results. And to do that, you can click on the checkbox at the top, and it will allow you to select multiple items. So when you click on the drop-down menu, it will allow you to select the first 1 to 50 items or just the items shown on this page. Now, once you have selected your preferred option, you can now choose from the available options. So you can download the results. You can save them to your dashboard. You can also add them to your project, share them, or you can also grab the citation of these records. There is also an option here to export the citation. So I know some of you are using Mendeley, ProCite, or Zotero. So if you want to export the citation, you can export it to Noodle Tools. You have your RIS format. So it includes ProCite, Zotero, Mendeley, and so on. So that's how you can bulk export results. Now, after running a search, you can also refine your results by applying filters. So filters are located just beneath your search box. So you can filter results by publication date. As mentioned earlier, it will be useful if you're looking for the most recent research or materials published within a specific period. And as mentioned earlier, I know it's very crucial to retrieve the most recent records or items. And you have your all dates filter to support that. And you can use this to limit the results to past 5 years or past 12 months and so on. So I'm going to limit my results to past 5 years. Aside from that, you can also filter the results to full text records. So as you can see, we're down to 3 results. So you can also select peer-reviewed and you have your source type. So if you're looking for academic journals, reviews, or clinical trials, you can use your source type filter. Now, additional filters will allow you to narrow down results by subject, language, or geography. So if you want to access other filters, you can click on all filters. And the filter panel slides in on your right-hand side. And here is all the available filters. So you can filter to peer-reviewed records. You have different databases here. You have your source types, your subject major heading, your publisher, language, age, and gender. So that's how you can filter results. So we have 3 results. And one of the advantages of utilizing filters is it's going to save you time because these three results are relevant to what I need. So if we review the filters, the results here will only show records published within the last 5 years, and I also have full text availability. Now, I also wanted to mention you have your old databases here. As mentioned, you have different databases. So you have your academic search complete, your dentistry and oral sciences, and you have your Medline and your Sinal complete. So this button will allow you to pick and choose the database or databases you would like to use. So I'm selecting everything here. I have selected everything, but later I'll show you your Sinal and your dentistry and oral sciences source. So from the search results, you can review the bibliographic information. So you have your title. Then you will also see your abstract. So the abstract, in case you don't know, is the summary of the full text. Then you also have your subjects here. And there is also an option to bookmark this item. So you can click on the bookmark icon and the system will save this record in your Save tab. Just just beside your bookmark icon, you will find your 3 dots or your kebab menu. And this allows you to access our available tools and features. So if you want to grab the citation of this record, you can click on Cite. And we have 9 different citation styles. So you can click on the drop down, and there are 9 different citation styles here. So if you need the APA 7th edition, it's selected by default, but of course you have other citation styles like MLA, Harvard, and so on. And as mentioned, you can also export the citation in RIS format. Next, you have the Add to Project, and this allows you to add this item to one of your projects. So I always say this. So your project feature, my analogy here is this is like your playlist. So if you have a Spotify or Apple Music account, this feature allows you to curate all the items that you need for your research. So it organizes and it manages the items in your dashboard. So if you're doing, let's say, a systematic review, you can add this item to your systematic review project. And then I'll show you later how you can export the items that you have saved in your project. So that's your add to project. Next, you can also share this. So you can upload this to your cloud storage. You have Google Drive and OneDrive, or you can also create a permanent link. You can also email this to yourself or to someone else. If you have a research partner, you can send this full text if it's available. If not, then they will receive the metadata. So all you need to do is enter their email address here, and they will receive the full text or the metadata. And finally, you can download the full text. Again, if it's available, you will see a full text tab here. If not, you can still download the metadata. So you have different formats. So you can download this in PDF, in CSV, and so on. Okay, so let's access the title, and it's going to bring us to the details. You have your references here. So it's one of the newest features. So it's called linked data. So when you go to references, it's just going to show you all the available references. So these are the references that this authors used for their research. So you don't need to access the full text just to access the bibliography or the references. And it also saves you time because as you can see, the titles here are hyperlinked. So you don't need to manually search for the title or the DOI. All you need to do is click on the title and it's going to bring you to the bibliographic information. So that's your references. There is also another feature here and it's called people pages. So you have here a quill icon, and if you see a green link, it means that people or information about this author is available. So when you click on this author, whose name or surname is Fujita, so it's going to show you the author's name, the total works of this author, the number of citations, and the number of co-authors. You will also see the top co-authors and the disciplines as well, topics. You also have here a link to OpenAlex. And if you scroll down, you will also see the works published by Naohiro Fujita. Then you can also change the sorting option by citation count or by published date. So again, that's what we call the people pages. So it's one of our newest features. Now let's go ahead and access the full text. So if you want to access the full text, you can click on Access Now, or you can also scroll down at the bottom. You should see an overview here of the full text. So let's click on Access Now. And when you click on Access Now, it's going to bring you to the actual full text. So this is in PDF version. You will see the title here. And then again, you have your tools and features. If you want to print this, you can click on the printer icon. And if you're connected to a local printer, you can select your printer's name and you can print this article directly from the platform. There's also an option here called text to speech. So if you're an auditory learner or if you have a visual impairment, you can enable the text to speech. So to enable the text to speech, you can click on the headset icon or what we call the listen feature. And you can click on the play button to enable the text to speech.
477 DOI 10.2169/Internal Medicine 3485-24 Intern Med 64 477 to 480 2020.
So that's how you can enable the text to speech. So that's your Medline Ultimate. So if you want to limit the results to Medline only, so you can click on all databases. And again, you can deselect everything first and you can select Medline Ultimate. And I also wanted to mention there are available filters on Medline Complete. So these filters are specific to Medline Ultimate. And if you scroll down, so your Medline Ultimate allows you to access special filters. You have your systematic reviews, you have your evidence-based medicine reviews, or methodology rather, and you also have your publication date, you have your age-related, your clinical queries. So you have therapy, diagnosis, prognosis, and you also have qualitative causation and so on. You can also filter by publication type. You have language and animals. So again, that's your Medline Ultimate. So I'm going to pause for a while to check if there's any questions. Again, if you have any questions, you can enter them in the chat. If you don't have any questions or clarification, again, could you please give me a thumbs up reaction so that I can continue with the next topic? Okay, I'm seeing one. How about the others? Okay, there are 2 reactions now. Okay, I'm seeing 6. All right, so that's more than enough. Hello, Miss Fidya, you're raising your hand. Do you have any questions? Yeah, you may unmute your microphone. Thank you.
Yes, good afternoon, Mr. Ryan.
Good afternoon.
I would like to ask how many subheadings of mass that can be included in one column of add field. So I try about like looking for two subheading, and then can we have like limitations numbers of how many subheadings can include in one column before we go to using the Boolean into the other columns. Thank you.
All right, yeah. So what you can do is you can combine your searches. So if you go to Medline, I'm just going to use diabetes as my example. So let's say you have diabetes mellitus and you want to combine the subheadings. I'm just going to select first, so I'm going to select blood and etiology. Then I'm going to add it to my search. Then what you can do is you can run your search first. So once you have retrieved the results, you can click on new search. So that will clear all your previous searches. Next, you can go back to Medline or mesh subject heading. Then for this, I'm going to search for obesity. So here is obesity, and I can expand this. So I can add obesity and add other subheadings. So I'm going to repeat the process. I'm going to add it to my search and run a search. So once you have retrieved all the subheadings and your main headings, what you can do is you can go to your recent activity. So that's under your dashboard, and it's going to show you all the searches. So you have your port search. So if you can remember, we searched diabetes earlier, and here are the subheadings. So you can tick this box, our fourth search, and if you want to combine diabetes mellitus and the subheadings with obesity and its subheadings, you can tick the fifth search. There is an option here to combine your search using the AND Boolean operator or the OR Boolean operator. So when you click on combine with AND, the search will move here, and then you have your fourth and fifth search. So I'll just get rid of this one. So here is my fourth and fifth search, and I can click on search. So we have 54 results because we use the AND Boolean operator, but if you're going to use the OR Boolean operator, yeah, of course, you'll have more results. And if we scroll through the list, so we have diabetes mellitus, and then you can also see the keywords that we're searching for. And you should also see obesity within the search results. So I hope that answers the question.
Yes, thank you so much, Mr. Ryan.
Sure, no worries. Yeah, you can also add manually to your search. So when you select a keyword, but I would suggest using the one that I showed you because that's more, I would say, organized, or it's easier compared to like picking your keywords here. Yeah, so you can also run your search. So I'm going to search for diabetes. Then you can add diabetes mellitus, then you can add it to your search. Then if you want to pick another subject here, let's say, sorry, let me search for a different keyword. So search for obesity. So if you want to add this to your search, you can also add this to your search and it will be added in the third row. So that's another option. But if you want to review the searches that you've conducted and see if you want to edit any keywords, you can use your recent activity, or you can also do what I did earlier. So to manually add the keywords in the search result or in the search bar rather. So I hope that answers the question.
Yes,
All right, thank
this answer
you.
my question. Thank you.
Sure. So that's Medline Ultimate. The next database that we're going to cover is your dentistry and oral sciences source. or what we call DOSS. So that's the initialism for this database. So this database is a definitive full text research resource for dental practitioners and researchers. And it covers a wide range of subjects, including cosmetic dentistry, dental public health, and endodontics, just to name a few. So, Dentistry and Oral Sciences source also provides active full text with no embargo for several top journals. Using this database, we're going to run a search using the advanced search feature. So the advantage of using an advanced search is it will allow you to search for something that is a bit more focused in advance. And you can also combine the combine keywords using the advanced search feature. So let's go back to the platform, and I'm going to search for this keyword. So I'm going to search for tooth avulsion and children. And we're going to search for case studies using your DOSS database. So I'll go back to your EBSCO host platform. Then I'll click on new search. And here is the advanced search. So as mentioned earlier, this feature will allow you to combine multiple keywords. So you can add up to 12 rows. So if you're searching for, let's say, more than 4 keywords, you can add more rows and it will allow you to add up to 12 rows. Now, aside from that, you can also combine your keywords using your Boolean operators. You have AND or AND not. And it also allows you to use a field code. So in case you're wondering, searchable field codes can be used to search within a specific section of a record. So it increases the precision of your search. For example, if you're looking for the author and you know the exact name of the author. So instead of instructing the system to search within the title, the subject, or the full text, you can use a field code. There is a field code here called author. So when you click on the author field code, the system will search within the author field only. So it's going to ignore other fields. So that's how you can utilize different field codes. Now, what I'm going to do is I'm going to enter my keywords. So I'll enter tooth avulsion. Then I'm going to combine this with children. Now, prior to running your search, as mentioned earlier, I'm going to search for case studies. So I'm going to scroll down before I click on the search button. I'm going to scroll down and I'm also going to make sure that I have selected DOSS as my database. So I'll click on select. Then I'll scroll through the list and I'm going to use my publication type filter. Sorry, not that. I'm going to use the document type rather. And then I'm going to scroll down and here is case study. So once you have selected your document type, you can now click on search. And it's going to bring you to the search results. So we have 17 results. And let's say you've come up with great search results and wanted to stay updated on the search results. There is a feature here called search alert, and it allows you to set up an automatic email alert. So you will receive emails from EBSCO whenever there is a new item that will be uploaded or added in your search results. So it saves you time as you won't have to constantly check the platform for new information. So if you want to set up a search alert, you can click on the 3 dots. So once you have retrieved your results, you can click on the 3 dots and you have 2 options here. So you can either save your search or create an alert. So I'm going to click on create alert. And here is the form. So if you want to change the alert name, you can delete your existing keywords and you can use a different alert name. And once you're done, just click on create alert. So that's how you can set up a search alert. I'll show you later how you can manage the alerts that you have set up. So let's scroll through the list. And since we're searching for case studies, so as you can see, this article is a case study. So you can also see your keywords. So the keywords are also highlighted or in bold. So you have teeth, children, or child. And if you want to access the full text, you can go ahead and click on Access Now. And here is the full text, and this is a case study. So that's your dentistry and oral sciences source. Do you have any questions or any clarification before we move forward? Any questions? Again, if you don't have any questions, could you please give me a thumbs up reaction? Okay, so I can see 1, 2. How about the others? So also wanted to check if you're still actively listening. Okay, thank you. All right, so the last database that we're going to cover in this session is your CINAL Complete. So CINAL Complete is the definitive research tools or tool for nursing and allied health professionals. And it provides fast and easy access to high quality content designed to support education, research, and evidence-based clinical practice. Through CINAL Complete, you'll be able to explore a wide range of top nursing and allied health journals, along with practical resources such as your evidence-based care sheets, quick lessons, and continuing education modules. So I'm going to show you how to search for quick lessons. So this database also includes full text access to many of the most heavily used journals indexed in CINAL, making it a reliable and comprehensive source for current and authoritative nursing and health sciences information. So using this database, I'm going to show you how to search for quick lessons, and I'm going to search for heart failure. So let's go back to the platform. So just in case you're wondering, quick lessons are clinically organized nursing overviews with information mapped to nursing workflow. So it's going to give you information about a specific condition. So like the description, signs and symptoms, assessment, your treatment goals, red flags, and what you need to tell to the patient or the patient's family. So you can print your quick lessons, and you can also use it as your reference, and you can also share it with your patients or patient's family. All right, so if you want to search for quick lessons, so just make sure that you select CINAL Complete, and then just enter your keywords in the search box. So I'm going to search for heart failure. Then I'm going to run a search. So you don't need to use your filters because the results on CINAL Complete are segmented. So as you can see, you have your evidence-based care sheets, your quick lessons, your images, and your videos. So if you want to access your quick lessons, you can click on quick lessons, and you have here, so you have 4 results. So you have heart failure and diabetes. So when you click on the full text, so it takes us to the full text. And as mentioned, your quick lesson will show you things like description or etiology. And if you scroll down, you have your facts and figures, your risk factors, signs and symptoms. And then if you scroll down, you have your treatment goals as well, food for thought. And then these are the red flags that you need to be aware of. So it's telling us that patients with diabetes mellitus who receive a beta blocker therapy are at risk for severe hypoglycemia because this medications mask in the early warning signs. So this is one of the red flags. And these are the things that you need to tell to the patient and the patient's family. So as you can see, it's very useful. And you can print this out. And then you can, as mentioned, you can use this as your reference. So that's how you can search for quick lessons. And that is Sinal Complete. So the next thing that I'm going to show you is our AI tools. So one of our AI tools, sorry, so let me go back to my slides. Now, before this, I would like to quickly show you our publication search. So if you want to search for any journals or reports, you can use your publications authority. So you can go here, and this allows you to search for different journals. So if you're, let's say, interested in a journal related to nursing, you can use your Sinal Complete. Then you can enter your keywords, or if you know the exact title, you can also enter the complete title in the search box, and you can run a search. So here is Nursing Administration Quarterly. And if you click on the title, it brings you to the publication information. So here's where you can find the ISSN, your publisher information, and then you also have the different issues and articles. So as you can see, it's very recent. So you have access to the different issues and articles in 2026. So you will see the volume number. And there is also an option to search within this publication. So if you want to search within this journal, you can enter your keywords here. So let's say I'm interested in nursing care. So I can run a search. So we have 445 results, and the system is searching within Nursing Administration Quarterly. So that's how you can search for different publications. Now, before I show you our AI tool, I would like to quickly discuss our dashboard. So again, if you go to your projects, it will show you all the projects that you have created. So if you want to export the items in one of your projects, you can click on the corresponding project, and it's going to show you the total number of records that you have in your project. So if you want to export the items here, you can tick the checkbox at the top. So you can download and save. You can add these records to a different project, export, or delete them. So if you want to download the items in your project, you can download this in PDF. If you open this file, you will see the table of contents, and then you will also see the bibliographic information. Next is we have the Save tab. So this is where you can find all the items that you have bookmarked or that you have saved. So you have two tabs, one for your records and then the other one for your searches. So if you want to, again, rerun your search, you can go to your searches tab and you can click on your keywords. So it's going to take you to the search results. Next is recent activity. So your recent activity will show you all the searches that you have conducted within this search. So it's session-based, just bear that in mind, meaning when you log out or when you turn off your device or your laptop or your computer, the system will automatically remove all your searches and the records that you viewed. So if you want to keep your search, you can bookmark them. So you can click on the bookmark icon. So we're going to skip the holds and checkouts. Finally, we have the alerts. So this is where you can manage the alerts that you have created. So you have your search alerts here. And you have here your search alert. So if you want to manage your search alert, you can click on the three dots and you can delete it if you want to. So that's how you can manage the alerts that you've created. So the last thing that I'm going to cover before we end the session is our AI tool. So it's called Natural Language Search. So natural language search, this is very interesting. So natural language search is a feature that lets you search using your everyday conversational language instead of complex keywords or Boolean operators. So essentially, a natural language search is like how you would search on Google. So all you need to do is enter your keyword or the entire question rather than keywords, and the results will be retrieved. So if you're going to conduct a search the traditional way, so what you need to do is you need to enter your keywords and combine them using your Boolean operators. But if you're going to use the natural language search, as mentioned, it's like how you would search on Google. So all you need to do is enter your question in the search box. So my search example for this is, are there repercussions from plastic surgery? So please bear in mind that natural language search is not on by default. So if you want to enable natural language search, you can go to your search options and then you can change your search mode to natural language search. So once you have enabled natural language search, you can now enter your question in the search box. So my question is, are there repercussions from plastic surgery? So I have selected natural language search. So I'm now going to click on search. So here are the results. So we have 25,713 results. You also have here recommendations. So if you want to explore other topics, so you have your suggested questions here or queries. And I'm going to disable natural language search just to show you the difference. So when you enable natural language search, you get 25,713 results. Now, if you disable this, so you will get no results. So there are no results at all. The reason is the system doesn't understand that this is a question. So it's treating this as keywords. But when you enable natural language search, it increases to 25,713 results. So that's how you can maximize natural language search. So when using natural language search, you also have an option to select show refined queries. When you click on this button, this will show you a Boolean version of your natural language query. So if you're going to conduct a search using the traditional method, what you need to do is you need to enter your keywords and then combine them using the Boolean operators. So your refined query serves as your verification tool just to ensure that our system correctly understands your question or your intent. So that's natural language search. Are there any questions regarding our AI tool? Do they have any questions or clarification? Okay, so I'm not seeing any questions in the chat, so sorry, let me skip this part. So go ahead and show you our help website. So this is called EBSCO Connect. So if you want to learn more about the things I discussed in this session, so you can go to our website. This is called EBSCO Connect. You can search for EBSCO Connect in your browser and it's going to take you to this page. So if you want to learn more about medical subject heading. So you can run a keyword search. So here is Medline medical subject headings. So if you want to learn how to run an advanced search using medical subject heading, you can visit this page. So I'm going to also share this link in the chat just in case you're interested in learning how to conduct advanced search using medical or Medline medical subject headings. So you can also watch recordings here. If you go to EBSCO Connect, you can go to Learning tab. We call this EBSCO Academy. So if you want to watch a recording, so there is a tile here called Watch a Video. So you can browse our collections. So you will see all the platforms here. So if you're interested in EBSCO host research databases, you can click on the tile, and here are the related videos. So that also takes me to the end of my presentation. If you have time, again, I encourage you to join our competition. And I also encourage everyone to like and follow our social media platforms. So you can follow us on Facebook, follow us on LinkedIn, subscribe to our YouTube channel, or register for our free training newsletter. Now, I'm all going to pause for a while to check for if there's any questions for me or if there's anything that you would like to know that I haven't covered yet. Again, you can unmute your microphone or enter them in the chat. My contact details are also up on the screen, so if you have any questions in the future, please feel free to contact me at ryansalas@ebsco.com. So I'll stop sharing now and I'll wait for any questions. And over to you, Mr. Adrianto.
Okay. Thank you very much, Mr. Ryan, for that comprehensive and enlightening presentation. Now we will move on the Q&A session. Maybe all the participants have question for Mr. Ryan. Silakan Bapak Ibu yang ingin tanya kepada Mr. Ryan bisa membuka mikrofonnya atau lewat chat box. Halo. Ada Bapak Ibu? Sudah jelas semua?
Ada yang raise hand, Pak?
Oh, silakan. Mr. Ryan, we have one participant in raise hand. Maybe please open your mic.
Thank you, Kang Ato. Sorry, I call you up, Kang Ato. Okay. Maybe I want to ask to Kandaga Unpad, or maybe Mr. Ryan also can explain. So if I try to sign in as previous, so I cannot connect with my Unpad account, or maybe if I want to sign again, because there is notifications that I already access using the Unpad. So should I also using another account, or if there is no my name there, just sign in my EBSCO Universitas Padjadjaran, because I cannot make project there. So I cannot make project because I have to sign in, and then when I try to sign in, I cannot use the Google account from Unpad. Should I make another account, or should I just access not sign in using the project? So just search like usual. Thank you.
Yeah, I think the library team can assist with the question regarding the access.
Nova, apakah ini masih trial atau sudah berlangganan? Ziani, sorry, untuk EBSCO.
Untuk EBSCO Medline Ultimate sudah dilakukan.
Suaranya kurang jelas, Teh.
Halo.
Ya.
Apakah sudah jelas saya?
Ya.
Untuk Medline Ultimate sudah dilanggan Pak oleh Unpad, hanya yang trial itu Snaihal sama Dentistry sama Academic Complete. Tuh.
Oke.
Terus kalau untuk misalnya tidak bisa diakses, mungkin tadi hanya dari dia bisa langsung menggunakan link EBSCO-nya, namun harus menggunakan WiFi Unpad Ibu. Seperti itu. Apakah sudah jelas? Mungkin ada pertanyaan lagi.
Oke, terima kasih. Jadi di Unpad, di perpustakaan ternyata yang sudah berlangganan itu Medline Ultimate, yang lainnya masih trial. Terkait untuk akses, ya mungkin kalau di Unpad dengan WiFi Unpad pasti sudah bisa. Tapi kalau untuk di luar Unpad, SSO-nya paling menggunakan pintu, dan pintu itu hanya untuk medical ultimate gitu ya. Kalau di dalam Unpad sih aman, bisa dibuka ya di mana saja asal terhubung jaringan Unpad gitu.
Izin menambahkan Pak Ato, ya Mbak Vidya ya. Sebetulnya kalau untuk yang trial harusnya sih bisa. Ini kesulitannya di apa? Apanya aksesnya atau apanya?
Sebetulnya saya sudah melakukan, sudah pernah search juga, tapi ketika saya coba membuat project, jadi my project, saya coba bikin folder, tidak bisa, itu saja. Untuk selebihnya
Nah itu yang di Medline-nya atau di yang lain?
Tadi coba Medline.
Oh, coba Medline.
Ibu,
Kayaknya
saya
mungkin kalau
bantu menjawab
oh
ya,
ya
Bu.
silakan. Ya silakan
Jadi
Bapak.
mungkin itu karena tidak bisa buat project karena belum punya akun My.EBSCO ya. Ya, Mbak Vidya.
Oke. Buat akunnya mah boleh pakai akun Unpad, maksudnya Gmail Unpad, atau harus buat sendiri, karena tadi saya coba masuk pakai akun Unpad belum bisa begitu. Jadi mengajukan sendiri ya.
Iya,
Bikin
jadi
akun
kalau yang akun My.EBSCO itu seperti kita kayak misalnya YouTube. Jadi YouTube kita bisa nonton walaupun kita nggak login akun. Jadi kalau misal login akun, baru kita bisa lihat historinya, bisa buat watch letter, jadi seperti itu. Jadi buat akun My.EBSCO seperti membuat akun Gmail ulang aja. Tapi bisa pakai akun email yang sudah dipunya. Jadi kayak buat akun seperti biasa aja. Itu baru bisa untuk membuat add to project untuk di save seperti itu.
Baik. Nanti saya akan coba untuk akunnya. Terima kasih.
Ya, terima kasih.
Yang trial juga bisa Mbak Okta.
Ya, kalau yang database yang sudah tertera yang tadi di EBSCO Host, semuanya bisa diakses, baik itu di dalam kampus maupun di luar kampus. Jadi nggak masalah. Mungkin itu aksesnya karena tadi nggak punya akun My EBSCO untuk save projectnya gitu.
Walaupun trial ya.
Iya, walaupun trial, tetap bisa diakses.
Oke. Thank you.
Ya.
Oke. Any question?
Sorry, Mr. Adrianto, I think there is a question in the chat regarding I'm just going to answer it. So the question is there a difference between Mesh PubMed and Mesh EBSCO host? So yes, there is a difference, but it's about the platform, not the mesh terms themselves. So EBSCO host mesh. So it's the same mesh terms used within the EBSCO host platform. And sometimes it's combined with EBSCO's own subject heading for non-Medline content. So in a nutshell, mesh terms are identical, but the search interface, the coverage, the implementation differ between PubMed and EBSCO host. So I hope that answers the question.
Oke. Bagaimana Mbak atau Pak Jerwil? Sudah terjawab? Atau Ibu Jerwil? Oke. Thank you, Mr. Ryan. Okay. We have time for the next question. Apakah ada peserta yang lain untuk mendalami atau bertanya kepada Pak Ryan? Oke. Miss Nafa, apakah cukup?
Mungkin kalau tidak ada yang bertanya dicukupkan, tapi jika ada yang masih ada yang ingin bertanya boleh.
Ya. Silakan Bapak Ibu, ada yang ingin bertanya lagi? Bisa lewat chat box atau lewat open mic. Dan kiranya Bapak Ibu juga dapat mengisi ya form evaluasi yang diberikan panitia melalui chat box dan linknya terlampir. Oke, mungkin sudah Tenafa ya. Cukup. Kayaknya nggak ada lagi.
Oke, Bapak.
Oke, thank you, Mr. Ryan, for the clear answer, for sharing his valuable knowledge and expertise with us today. And thank you to all participants for the engaging question. Thank you all participants for your enthusiasm and active participation. We hope the strategies that Mr. Ryan shared today will help you discover the EBSCO Ultimate oral dentistry or CHINAL database, and maybe more support your research or your studies. Thank you, Mr. Ryan.
Thank you, Mr. Adrianto, and thank you everyone for inviting me, and have a wonderful weekend. Thank you. Terima kasih.
Okay, once again, thank you everyone and have a great day ahead.
Baik. Ya, baik. Terima kasih Bapak, and thank you so much for Mr. Ryan. Thank you so much for all participants. Okay, so I think before we call this event, let's take a photo group. So everyone, please turn on their camera or take a photo group. Okay, so this is the 3 slide. Okay, first. 1, 2, 3. Next slide. 1, 2, 3. And the last slide. 1, 2, 3. Baik, terima kasih banyak kepada Bapak Moderator, juga terima kasih banyak kepada Ibu Kepala yang sudah membersamai kami, juga tim dari Kantor Pengelolaan Perpustakaan. And of course, thank you so much for our speaker, Mr. Ryan, and of course from EBSCO team, thank you so much. And of course, thank you for all participants. I'm Master of Ceremony. Wassalamualaikum warahmatullahi wabarakatuh.
Terima kasih Bapak Ibu.